Uh, Dr. Vivek Varkar, next presenter.
I think no. Okay. किधर लोड हुआ है? Yes, so good morning to everyone. So basically, this is the work. One of my DNB resident, she has work, and I do not have any financial disclosure. So as we all know that craniosynostosis is a premature fusion of one or more cranial suture, and it has, the estimated incidence of 1 in 2000 or 2500 live children. It can occur spontaneously and as a part of syndrome, or it could be, the hereditary, and it is always associated with n number of systemic disorders. So it can be classified as, the non-syndromic and syndromic, or you can call like non-syndromic type as an isolated, where there is involvement of single or multiple sutures. And these are the different syndromes that we do have in a syndromic variety, which is 20% in incidence. So the objective of this today's, the descriptive study is to define the demographic profile and ocular manifestations, analyze the cause of visual impairment, and what are the risk factors associated with amblyopia. So it was a retrospective study done at 4, the tertiary eye care centers, and the study population were included all children less than 18 years, and there was a sample size of almost 232 children. Those children who were less than 18 years of age, patient with both syndromic and non-syndromic category, cases that underwent neurosurgical intervention, including frontoorbital advancement or suture release, were also included, and patient who underwent ophthalmic interventions like strabismus surgery or tarsorrhaphy, they were considered. Those who are like lost to follow-up and patient with an undetermined diagnosis were excluded. So diagnosis was based on the basis of the clinical, radiological, and assessment by the craniofacial surgeons, and then the demography, history, ocular examination finding, general examination finding, and any dysmorphic features, they were noted. So age-appropriate vision testing, cycloplegic refraction, and the data that was analyzed using the Strata 13 software. So if you look at the results, I think it's more prevalent in male children. The mean age at presentation was almost 5 years. Then the chief complaints that they presented with was defective vision followed by squinting of their eyes. If you see that majority of the patients, they fell into the category of non-syndromic variety. And you see the 32% presented with defective vision, 18% referred by the treating physicians, 18% presented with deviation of eyes, and 14% had proptosis. So the delayed milestones was observed in 38% of the children. There was no significant difference between two groups in terms of consanguinity or positive family history or type and mode of the delivery when they presented in a clinic. Depending upon the sutural involvement, I think the clinically unicoronal followed by the bicoronal sutures were diagnosed more often, and radiologically the one who had the more than one suture involvement were the common type, followed by the unicoronal sutures. Visual acuity and visual impairment, if you categorize them mild, moderate, severe, and blindness as per the WHO classification, I think the prevalence of visual impairment was quite high, 64% when we compare with the Western world. Refractive error, 54% of the patients, they had astigmatism. That was the commonest refractive error that we found. And astigmatism was found to be more in unicoronal craniosynostosis compared to the multisutural. Then distribution of strabismus, exotropia is the most common type of strabismus in both the groups, followed by the vertical deviations. Exotropia is more common in multisutural craniosynostosis than vertical deviation. So if you look at the common causes of visual impairment, I think the amblyopia, then astigmatism, exposure keratopathy, papilledema, optic atrophy, this is what comparison with the the different countries that data they have published. So I think we have a delayed presentation, quite often visual impairment, optic atrophy is very common, and the amblyopia is more prevalent in our population. However, the strabismus is less common compared to the Western world. So these are the limitations. Obviously, because of the retrospective nature, did not have the radiological and clinical data to review at the time of presentation, and obviously difficulty in examining these children because of systemic disease and developmental delays. So to conclude, syndromic and non-syndromic patients continue to have a high frequency of amblyopia as a risk factor and ocular problems. Incidence of craniosynostosis in our population is very low. Optic atrophy and proptosis, they are the major cause of the visual impairment. And I think exotropia is the most common strabismus type in both syndromic and non-syndromic. Thank you.
What was the cause for optic atrophy in these patients?
Optic atrophy, majority of the time they had the bilateral disc edema, papilledema, because of the raised ICT.
Thank you.
Thank you. Thank you, doctor.
Thank you.